It's time now for Medical Monday. Here with us, Dr. Stephen Schmidt and Janelle Klubertons with Bay Care Clinic. We are talking about Botox today.
Yes.
Okay, so first of all, for people who don't know, what is Botox?
So Botox is the FDA-approved medication for wrinkles in between the frown lines, crow's feet, and forehead. It is the #1 study drug by the FDA, so we know it's safe.
And that's what I was going to ask. We always think, I don't know, whenever you think Botox, you think older women who are going in and get this to look younger. Is that the case always?
Not so much. We're actually seeing an increase population in our younger patients coming in to kind of help prevent the fine lines and wrinkles that we develop with aging.
So for prevention, as opposed to whenever you get them and you're older and you have that wrinkled skin, you're doing this beforehand, and it does prevent.
Absolutely.
Okay.
Yes.
It is safe.
It is safe.
So
yes.
Tell us a little bit about, the people who are using it versus, who should be using it.
So we have a wide variety of patients, lots of ages, patients that have the, deep furrows between their eyebrows, crow's feet, or forehead. It's safe for all those areas, and the results are great. Lasts about 3 to 4 months, and then we're coming back in for repeat injections, but the results are fantastic.
Some people come to the office and think that Botox is going to cure all the wrinkles on their face.
Not the case?
Not the case.
Not the case.
And that's where some treatment and counseling before the treatment is really necessary to make sure that they're a good candidate for this, that their expectations are realistic. In other words, that when we give them the Botox, that it's going to accomplish what they're desiring for it to do, and for them to understand how it works, when the onset is, and so forth. So it's more than just go get some Botox and off you go. It's a lot of.
It doesn't give you a whole different face look, right?
No, no, it's
not.
for targeted areas.
Sure.
And areas, it works by paralyzing muscle. So of course we don't want to paralyze muscles that we use for expressions we want to make. So that's where a skilled injector makes all the difference in terms of having a nice outcome.
Okay, another question for you. Who should be giving these injections? Because, it is a shot, right?
Sure.
So not everybody can just be giving these things.
Well, you'd be surprised. There are a lot of people out there giving Botox.
Really?
And we're not here to say that only certain people should be doing it, but I tend to think it's kind of like giving somebody a palette, some oil paints and a brush and a canvas and saying, paint me a Renoir.
Sure.
I can't do that.
Sure.
And so it's the same thing with Botox and different tools that we have for rejuvenating the face. You want to make sure that the person is very skilled, trained, and is in the right setting. Is this a core aspect of what they do in terms of their practice?
And you just want to be safe. This could really, hinder your face, right?
Sure.
Absolutely.
So it's not only getting a nice outcome, but it's also, just as you said, preventing complications.
All right, sounds wonderful. We'll have to look into it. Thanks so much for being with us. For more info about Botox and Medical Monday in general, just go to our website and click on this story. Well, pets are members of our family, so